This is the Hand Surgery Clinic. I'm Sanjay Miranda. Today we're going to talk about taking care of your hand after an operation. This is a very frequently asked or discussed point after an operation. So typically somebody will have had a surgery either in the palm or the heel of the hand or the wrist. My usual advice for a lot of these smaller procedures is that the bulky bandage which has been applied after theatre is kept on for 5 days. The challenge is often keeping this clean and dry, which is really important because getting the wound wet will certainly increase the risk of infection. So there are many creative ways. There is plastic bag can be used, a marigold glove can be applied over the top. There are also some commercial sleeves which can be slipped across the forearm to keep the hand from getting wet. Then my usual advice after 5 days is to remove the bulky bandage. There'll be a small adhesive dressing either in the palm or the heel of the hand. Typically for carpal tunnel surgery it's here, or trigger finger surgery it's here. These dressings should be left undisturbed. What you'll often see sometimes is blood marks on the dressing. Now don't change or peel the dressing, but just apply a new dressing on top of it. Of course, if the dressing falls off, then it must be covered, but I wouldn't specifically change that dressing regularly. The more the dressing is changed, in fact, it increases the risk of infection. So still continue the same strategies from keeping it dry, not getting it wet. The second aspect is taking pain relief. It's really important. These procedures that I described for the smaller hand procedures are usually done under local anesthetic. That means that there is an injection to numb the area of the surgery, but the arm is not numb and you're awake for the surgery. So that local anesthetic, in my practice, I usually apply, will last about 3 to 4 hours after the operation. So it is important to start taking your pain relief on a regular basis. Usually this advice will be given before your discharge, but normally paracetamol regularly, if you follow the packet advice, would be up to 4 times a day, or ibuprofen if there are no contraindications to you taking it. But again, do check with the team on the day of discharge what pain relief to take. But the important point is to start to take it before the local anesthetic wears off. The next point is exercise of the hand. I usually recommend a very simple exercise with trigger finger or carpal tunnel surgery. This is to start the day after surgery. So usually it's making a claw position and then into a fist. Gently, you don't need to make it tight. So claw and then a fist position. So this is done a dozen times every 3 hours. And that's usually again to start the day after surgery. Following the surgery immediately, you'll be given a sling to keep the arm in. My advice is that's very important. Keep the hand and elbow elevated at shoulder height. So if you're sat up, maybe some cushions or pillows to stack the arm up. If you're laying down, simply resting on the chest will be sufficient. Then the following few days, if you're out and about, we use a sling to keep your arm up, otherwise it'll get tired. But definitely don't let the hand hang down, because that will encourage a lot of swelling to happen, which will just slow down your recovery. After 3 or 4 days, then see how your hand is doing. But again, I would encourage, if you feel a sense of swelling or you see swelling, then again, give it some elevation as well. So we've talked about keeping the dressings dry, when to remove it. We've talked about pain relief, we've talked about exercise, and we've talked about elevation. So I hope this is helpful for you in guiding you and reminding you of the advice given to you after your hand surgery. I wish you well. All the best. Thank you for watching.